Every motion, every movement we make is a silent testament to the complex interplay of our bones, muscles, and joints. Yet for millions of people around the globe, each of these movements can be a source of discomfort, even pain. Hello and welcome to our health channel where your well-being matters the most to us. Arthritis, a condition marked by inflammation of the joints, has increasingly become a burden for many of us. It can snatch away the joy of simplest actions, lifting a cup of tea, a walk in the park, or even just turning a doorknob. But fear not, you're not alone in this journey, and we're here to support you. Today, we're exploring the intricate relationship between our diet and arthritis, highlighting the top 5 inflammatory fruits that could be worsening your symptoms. Remember, what we consume can either dampen the flames of inflammation or fan them into an inferno. In this video, we'll take a deep dive into the science behind these fruits, how they interact with our bodies, and why you might want to reconsider including them in your diet if you're battling arthritis. Our aim is to help you make informed dietary choices that could potentially lessen your joint pain and inflammation. As always, this video does not replace medical advice. If you're experiencing severe symptoms or have any concerns, please consult with your healthcare provider. Now let's begin our journey towards understanding, managing, and hopefully easing your arthritis symptoms, one bite at a time. Here are the top 5 inflammatory fruits that you may want to avoid for arthritis. Number 5, citrus fruits. This category includes fruits like oranges, lemons, limes, and grapefruits, which are commonly associated with health benefits due to their high content of vitamin C and other beneficial nutrients. However, for some people with arthritis, consuming these fruits might not be as beneficial. The idea is that the acidic content of citrus fruits could potentially irritate the joints and amplify the symptoms of arthritis. This may manifest as an increase in pain, swelling, or discomfort in the affected joints following consumption. Now, this isn't to paint citrus fruits as the villains here. In fact, they're rich in vitamin C, which is a powerful antioxidant known for its anti-inflammatory properties. That's why some individuals might actually find relief in their arthritis symptoms with a moderate intake of citrus fruits. It's a classic example of how dietary responses can be very personalized, and what works for one person might not work for another. It's always wise to listen to your body and notice any changes following the consumption of certain foods. Number 4, tomatoes. Who doesn't love a juicy, ripe tomato? But did you know that tomatoes are technically a fruit? They are also a member of the nightshade family, along with potatoes, eggplants, and peppers. Now, the relationship between nightshade vegetables, or fruits in this case, and arthritis symptoms is a bit controversial. Some people with arthritis have reported a worsening of their symptoms after consuming tomatoes and other nightshades. It's thought that an alkaloid called solanine, present in nightshade vegetables, could potentially cause inflammation, thus exacerbating arthritis symptoms. However, the scientific community hasn't reached a consensus on this topic as the evidence is limited, and the research findings have been somewhat inconsistent. What this emphasizes is that the reaction to tomatoes, like with citrus fruits, can be highly individualized. Some people might find that tomatoes aggravate their arthritis symptoms, while others might enjoy them without any adverse effects. A useful approach can be to keep a food diary, noting any changes in your arthritis symptoms following the consumption of tomatoes and other potential trigger foods. Number 3, mangoes. Mangoes are often known as the king of fruits due to their sweet, juicy flesh and a wide array of health benefits. They're packed with vitamins, antioxidants, fiber, and yes, natural sugars. While they're undoubtedly healthy in moderation, like most fruits, consuming them in excess can lead to elevated blood sugar levels. These sudden spikes in blood sugar can trigger an inflammatory response in the body, potentially worsening arthritis symptoms. It's the classic saying, too much of a good thing can be bad. Now, mangoes also contain a natural chemical called salicylates. While salicylates can be beneficial and are even used in pain medications like aspirin, some people might be sensitive to them, leading to an inflammatory reaction. This might cause discomfort or exacerbate symptoms in some people with arthritis. It's worth noting that the concentration of salicylates in mangoes is generally low, but if you're particularly sensitive or if you're consuming a large quantity, you might notice an effect. Number 2, bananas. Bananas are another widely loved fruit that offers numerous health benefits. They're an excellent source of potassium, vitamin B6, vitamin C, and fiber. However, like mangoes, bananas are also high in sugar, which means they can contribute to inflammation when consumed in excess. It's a balance between enjoying the benefits they offer and not going overboard to avoid spiking blood sugar levels. But sugar isn't the only thing to consider here. Bananas are also high in lectins, a type of protein that can bind to cells in your body. Some research suggests that in certain individuals, these lectins might provoke an inflammatory response. However, most people can tolerate lectins without any issue, and many healthy foods, like whole grains and legumes, contain them. Remember that the body's response to food is highly individualized. Some people might find that bananas and mangoes exacerbate their arthritis symptoms, while others might enjoy these fruits without any problems. If you suspect these fruits, or any food, might be worsening your arthritis, it's worth keeping a food diary to track your symptoms in response to different foods, or consider working with a healthcare provider or dietitian. And always remember, moderation is key with any type of food, especially those high in sugar, even if it's natural sugar. Number 1. Dried fruits. The consumption of dried fruits deserves careful attention when it comes to maintaining a healthy diet. Although they are a convenient, tasty, and seemingly healthy snack, there are some significant nutritional aspects to consider. The most important factor is that dried fruits are remarkably high in sugar and calories. The dehydration process that creates dried fruit eliminates its water content, which means the natural sugars within the fruit become more concentrated. To illustrate, while a cup of fresh grapes may contain about 60 calories and 15 grams of sugar, a cup of raisins, which are dried grapes, can contain up to 500 calories and over 100 grams of sugar. Regular consumption of these high levels of sugar can lead to a variety of health issues, including obesity, tooth decay, and insulin resistance, a precursor to type 2 diabetes. Furthermore, excessive sugar intake can prompt an inflammatory response in the body. Chronic inflammation is associated with a multitude of diseases, including heart disease, cancer, and autoimmune disorders. Sugar encourages the release of inflammatory messengers called cytokines, and spikes in blood sugar levels can produce more of these inflammatory signals. In addition to their high sugar content, dried fruits can also be high in calories, which can contribute to weight gain if not consumed in moderation. Gaining weight can put strain on the body's systems, increasing the risk of diseases such as hypertension, heart disease, and type 2 diabetes. Another aspect to note about dried fruits is their common use of preservatives. Many dried fruits utilize sulfites to maintain their appealing color and prolong their shelf life. However, some individuals are sensitive to these sulfites and may experience an inflammatory reaction as a result. Symptoms of sulfite sensitivity include skin rash, swelling, stomach cramps, and in severe cases, difficulty breathing. In the context of chronic diseases, these inflammatory reactions can exacerbate conditions like asthma, chronic obstructive pulmonary disease, and inflammatory bowel disease. Despite these potential drawbacks, it's important to remember that dried fruits still retain many of the nutritional benefits of fresh fruits, including dietary fiber and various antioxidants. They can be included as part of a balanced diet, but they should be consumed in moderation with attention to portion sizes. Opting for sulfite-free and unsweetened varieties can also help mitigate some of the health risks associated with their consumption. Always be mindful of nutritional information when incorporating dried fruits into your diet to ensure that you're not exceeding your recommended daily intake of sugar and calories. As we conclude today's journey, we want to remind you that living with arthritis doesn't mean giving up the activities or foods you love entirely, but instead, it's about better understanding your body's unique responses and adapting accordingly. Every person is unique, and what might trigger inflammation in one individual might not do the same in another. It's important to remember that our diet is just one piece of the arthritis management puzzle. While avoiding certain fruits might be beneficial for some, it's not a guaranteed solution for all. Keeping a balanced diet, rich in anti-inflammatory foods such as berries, green leafy vegetables, fatty fish, olive oil, and nuts, alongside regular exercise and proper medical treatment, can make a significant difference in managing your arthritis symptoms. As we've discussed today, Some fruits, like citrus fruits, tomatoes, mangoes, bananas, and especially dried fruits, might exacerbate arthritis symptoms in some individuals due to their sugar content, acidic nature, or presence of specific compounds. But it's crucial to not demonize these fruits. They are packed with essential nutrients and can certainly have a place in a healthy diet. Moderation and observation are key. Keep track of your symptoms, maintain a food diary if needed, and don't hesitate to consult with a healthcare provider or a dietitian for personalized advice. Thank you for joining us today, and we hope that this video provides some useful insights for you in managing your arthritis symptoms. Remember to like, share, and subscribe to our health channel for more educational content.